So many of you are talking about a video that went viral this week of a small group of doctors saying that we're not getting the whole truth about how to fight COVID-19.
Social media sites have since pulled that video down, and tonight we spoke to two local doctors, one calling that video important, another calling it dangerous.
Let's not react to the disease. Let's get in front of the disease.
Oklahoma City doctor Noel Williams says his number one criticism is that we're not doing enough to treat COVID-19 early.
The FDA, the NIH, the CDC, the U.S. Public Health Service have done nothing to train or help physicians manage these patients before they get to the hospital.
That's why Dr. Williams says we are closing the door too early on other drugs, including hydroxychloroquine.
Many doctors think it is extremely successful, the hydroxychloroquine.
President Donald Trump again throwing his support behind the controversial medication. This after retweeting a video of a Texas doctor claiming she had treated at least 350 COVID-19 patients with hydroxychloroquine and had not lost a single patient.
She said that she's had tremendous success with hundreds of different patients, and I thought her voice was an important voice, but I know nothing about her.
But we are learning much more about Dr. Stella Emanuel. She is also a minister. In one sermon posted online, she claimed health issues like endometriosis and infertility can be caused by demons. Twitter, Facebook, and YouTube all remove video of Dr. Stella's viral speech calling hydroxychloroquine a cure. Dr. Stephen Prescott, the president of the Oklahoma Medical Research Foundation, says there is no known cure for coronavirus, and that includes hydroxychloroquine.
There's no evidence now that taking this will prevent COVID-19 or even treat mild to moderate cases.
Dr. Prescott says videos like the one retweeted by the president are only making things worse and inserting politics into public health.
There's been this increasing distrust of experts and people who've spent their whole life studying this thing, and then suddenly their opinion counts the same as some person on the street.
But Dr. Williams says blocking dissenting opinions is dangerous, especially now.
We're failing at COVID. I mean, look at how badly we're doing. And they don't want us to talk about it or debate it or think about it. Just follow the plan that's not working. Doesn't make sense to me.
Now, the state of Oklahoma spent $2 million on hydroxychloroquine this spring after its effectiveness was touted by President Trump.